Hello everyone, I'm Dr. Pratyush Kumar from India. I'm the chair of Wonka Role South Asia and the founder of this project Happy, which is health advice and promotion, disease prevention among youth and geriatric age group. So today we are going to talk about depression. Depression is a common illness worldwide with more than 300 million people affected, and the burden is on the rising trend. Depression is different and should not be confused with usual mood fluctuations and short-lived emotional responses to challenges in everyday life. Depression is an illness characterized by persistent sadness and a loss of interest in activities that you normally enjoy, accompanied by inability to carry out daily activities for at least 2 weeks. In addition, people may have loss of energy, a change in appetite, sleeping more or less, anxiety, reduced concentration, restlessness, feeling of worthlessness, guilt or hopelessness, and thoughts of self-harm and suicide. And these are something which can happen to anybody, and these are not signs of weakness. Remember, these all conditions are treatable with taking antidepressant medications or with talking therapies or with both. Depression actually results from complex interaction of social, psychological and biological factors. People who have gone through adverse life events like unemployment, bereavement, psychological trauma are more likely to develop depression. Depression can in turn lead to more stress and dysfunction. So if you're feeling depressed, talk to someone you trust and share your feelings. Most people will feel better after talking to someone who cares about them. Seek professional help. Your family physicians is the best place to start with. And remember, with the right help, you can get better. Keep up with the activities that you normally enjoy when you're well. Do regular exercise, take regular meals, and accept that you might have depression and adjust your expectations accordingly. Avoid alcohol or smoking as a solution to depression. So what happens that sometimes you're fine, you're living well, but you know someone who is a bit depressed, then you should try to help them. And how you can help them is that first thing is that make it clear that you want to help. Listen without being judgmental and offer support. Encourage them to seek professional help when and wherever available. Offer to accompany them to appointments. Check that whether they are taking medications regularly or not. Be patient. It usually takes a few weeks to feel better. Help them with everyday tasks. Encourage them to focus on the positive aspects of life rather than being consumed by all the negative thoughts. If they're thinking about self-harm or have already intentionally harmed themselves, do not leave them alone. Seek further help from the emergency services or healthcare professionals. In the meantime, remove items such as medication, sharp objects, and firearms. Take care of yourself too. Try to find ways to relax and continue doing things you enjoy. If there is feeling of worthlessness, hopelessness, and suppose you're consumed by negative thinking and you're thinking of suicide as a relief, then I must tell you that you're not alone in this struggle, in this fight. Many other people have gone through what you are going through and they are alive today. It's okay to talk about suicide. It's always better to talk about suicide. It can help you feel better. Having an episode of self-harm or suicidal thoughts or plans is a sign of severe emotional distress. Perhaps as a result of the loss of loved ones or loss of employment, a relationship breakup, or an experience of violence or abuse. So you are not to blame and it can happen to anyone. You can remember you can get it better with treatment. There are treatment available. There are people who can help you. And for all those family members, common people, the support of carers, friends, and family facilitates recovery from depressions. Patience and perseverance is needed as recovery can take time. Thank you.
15th World Wonka Rural Health Conference